So again, with the gentle introduction on behalf this good evening today, we are going to the topic. It will be very simpler and very easy to understand. But when I talk to you, you will understand that we never thought in that manner. You will understand now. I hope. These are the clinical pictures and must clinical picture in your exam. So be ready, doctor. I will try my best to make you understand. You see, the picture is telling many things. And it is said that one picture means one picture is equal to 1,000 words. 1,000 words. Okay. So what the picture is telling to you? Who can say?
Chest pain.
Doctor?
Chest pain.
Okay. Then?
Radiating to left arm and to the neck, I think.
Okay, quickly.
This I'm not sure about the rest of the, but this is chest pain to the left arm. I think tightness.
Okay.
Maybe shortness of breathing.
Okay.
Increasing with exertion or proceeding by exertion.
Okay.
He is a smoker.
Okay. Fantastic. Proceed more.
Old, old male.
Old male. Okay.
Just like this.
Only up to this, you become tired. Can anybody else add more? Other colleague, add more. What is the season there?
Female, plain of chest pain. And relieving by bending forward.
Relieving by bending forward? No, actually he become bent for the pain and he's going up a stair, doctor.
Where is the stair? Oh, okay. You have to make an arrow in the stairs.
Why? I will tell arrow, doctor. I have given you picture and you explain it. Any more thing, other colleague? Dr. Shaza, Rasha, they're looking only but telling nothing.
Okay, there is a wind. Is it called?
Maybe winter. Is a heavy cloth is there, right? So winter season. And did possibly he came out from the restaurant after huge food. Okay.
From what? Sorry, I didn't get that.
Restaurant, doctor.
Yes, restaurant. Okay.
Restaurant.
Why you said that, doctor? I didn't. Why? Yani, how did you? I mean, where is the clue? He came from restaurant.
Just near the restaurant is coming up. Restaurant picture is there. Maybe he took some food there. After that, he developed severe chest pain. And the description of the chest pain radiation was mentioned there. Now the diagnosis is clear, right?
Yes.
So should we tell any message, any text to you, doctor? Is not enough to say this is a diagnosis?
Okay. Yes, angina.
Like this, a picture, how much powerful. But did we think in that manner, doctor, when we look at the picture? Possibly no. Possibly no. So always we will try our best to think it. Even the textbook also telling nothing because it is our general and common sense we have to utilize. The book is telling typical ischemic pain. They are not telling the whole description. Okay. So think like this. Now pictures in the clinical practice, which are the common, we will try to give you. And we make the group of the pictures in different anatomical part of the body, especially the face and other part. So look at the face and give your impression quickly. What you are looking, everybody have access to open and tell what you are looking in this picture. Just tell a gross finding, one gross finding.
The eye is in the right eye is not
tell the finding by scientific anatomical way. Who can say the name of the finding?
Ptosis.
Can anybody complete to say? It is ptosis, no doubt, but ptosis should be partial or complete. What is this? Dr. Abdullah, I still didn't get the clue. Partial ptosis or complete ptosis?
Partial.
Partial ptosis. And look at the, just look at the forehead quickly. Is it more wrinkle? It is more wrinkle or less wrinkled?
More wrinkle.
More
More.
wrinkle. So does patient have any muscular weakness here?
People's pulse.
I am asking, does patient have any muscular weakness of the frontalis muscle?
Yes.
No. If
No,
the weakness is there, how can patient wrinkle the forehead?
preserved.
Left side, not wrinkle.
Rather, more wrinkling means more acting. So this partial ptosis or ptosis is not due to muscle disease. It is due to nerve
No.
problem. Nerve problem, sympathetic nerve problem. Clear now, Dr. Hind, why I am asking you the muscle issue? Because sometimes ptosis may be due to the myopathy. For that, what you are looking here?
Right side. Bell's palsy.
Bell's palsy. Which cranial nerve involved here?
Right side.
Right sided. The Bell sign. What is the causative organism? More likely virus. Idiopathic,
Herpes.
though it is said, post-viral.
You wish your
Post-viral.
herpes.
Post-viral. Again, what is this? Diagnosis.
Left side. Bell's palsy.
It was my chamber, doctor. Look at. You have seen before the yellow wall. Now wall was white. Actually, previously it was white. Later on, authority made it white color. The same room. Huh? Okay. Facial deviation towards the right side. So diagnosis is
Left side. Bell's palsy.
facial palsy. Bell's, you need to produce the Bell sign here to tell the patient to close your eyes. At that time, it will be easier to say. Otherwise, you can say left-sided facial weakness. Here, doctor. What is
Jaundice.
this? Hmm?
Shingle. Shingles.
Can you specify this, the diagnosis, other than only telling shingles?
Herpes zoster.
Ophthalmicus. Herpetical ophthalmic.
Herpes zoster ophthalmicus. Why to say ophthalmicus?
Because
Detail.
Eye
No.
involvement around the eye.
Emergency. We need to refer the patient to ophthalmologist right now. Herpes zoster ophthalmicus. What is this?
Vitiligo.
Impetigo. Why not? This is herpes zoster, herpes labialis. Not zoster, herpes labialis.
Not involved lips. Because
Not involving lips means not involving mucocutaneous area. This is impetigo. Golden crust. But this is herpes simple. Herpes simple. Simplex. Okay. Sorry, doctor. This is spelling mistake. Herpes simplex. Mucocutaneous area is involved. This one the same, right, doctor?
yes.
Yes.
This actually slide is this herpes simplex again. I'm sorry, doctor. I just tried to correct, but just to differentiate it, we have shown to you. Look at the differentiating point. This is the mucocutaneous, and this is not mucocutaneous. Only the skin issues are there. You see, only the skin issue. So this is impetigo. This is herpes simplex. What is this, Dr. Abdullah? This patient developed this appearance one day after making dye at the saloon.
Allergic eczema.
Irritant.
Basically, this is contact dermatitis, but what is the type? Irritant or allergic?
Allergic.
Irritant
think.
only at the site of contact. What you are looking? Patient having warm feeling, excessive sweating also. and a little bit restless.
Exophthalmos.
Tell the whole diagnosis.
Graves disease.
Graves disease with hyperthyroidism.
Hyperthyroidism, yes.
Graves is not same with hyperthyroidism. Remember, Graves is the disease name, Graves disease. Hyperthyroidism is the functional status of the disease. Okay? So hyperthyroidism actually not the disease. Hyperthyroidism is a functional outcome of the disease. This lady, what happened to her?
Thyroidectomy.
Okay. Thyroidectomy for which indication?
Malignancy.
Malignancy. Why you are telling?
Radiotherapy.
Radiation mark is there.
Yes.
What is this, Dr. Hind? This is a family medicine issue again. What is this? Where is my colleague Rashid here? He can tell something in his language. But in your culture, in Arab, what is this? There is some spiritual rope, and there is some material like this, like a button. Sometimes some text from the Holy Quran is like this. What you are looking?
Yes.
This
Like
one
Sudan.
in Sudan also available.
Yes.
In our country also available. I don't know what you said, doctor, in your language. This thing.
Hijab. بالعربي.
Sorry, I don't understand. There is some one word also here, the name. So it indicates this is a prejudice. Prejudice, and sometimes people uses this thing if patients suffer for a long time. Some spiritual treatment like this, rather to say. And this lady, what happened to her?
Operation. Goiter.
Again, thyroidectomy. Possible indication of thyroidectomy in this lady?
Goiter.
No, doctor, you can tell the name of the disease. Goiter is just visible thyroid is the goiter. What may be underlying disease? The malignancy or non-malignancy?
Not
Malignant or
malignancy.
non-malignant? Why you are thinking non-malignant? Because the apparently healthy looking lady, there is no radiation mark. Okay.
Yes.
Mm.
No.
What is your findings? Tell anyone.
The light.
If you want to say, you can tell many things. This is a patient, she is lady and her hairs are scanty. Is not it?
Yes.
And the skin have vitiligo, some pigmentation. And the vitiligo features in the joint area of the friction. So what is the diagnosis? This is vitiligo. But what endocrine disease or other autoimmune disease is associated with this lady? Patient have the joint pain. Multiple joint pain. What may be associated disease?
Addison's disease.
Joint pain happen in Addison's disease, doctor. Addison's is endocrine disease. It is not disturbing too much.
Monday.
Huh? Lady, look at the face and look at the hairline, doctor. Hairline is the hairline recession is there. Alopecia is there. Joint pain, alopecia in the female. We have to think first. Systemic lupus erythematosus.
Still eight.
We need to exclude or include later, but when alopecia is there, we have to think, could it be SLE or not? How we are thinking SLE? Vitiligo is autoimmune disease, SLE also autoimmune disease. In this way, it will be also related to each other. Okay. Now, question to you that you are thinking this is vitiligo, patient might have Addison's disease. Possibly Dr. Abdullah said one associated Addison's disease. What do you like to look for Addison's disease?
Hyperpigmentation.
Hyperpigmentation. So in the face, there is some hyperpigmented area, but you are not satisfied with this picture. What you will tell to the patient now to see?
Blood pressure.
No. You will see only, not palpate or do something. You just require the patient to open the mouth and look at the pigmentation inside, that is in the mucosal pigmentation. Will be better. Now, overnight, this gentle lady developed this appearance in the face. It was also my patient in my chamber. What do you think?
Angioedema.
Angioedema. Very good. Very good. Buried eye. What you are looking? Doctor, don't write here.
Sorry.
No problem. I'm doing. Right. Control it. Annotate. Look at the picture, doctor. Look at the picture.
Moon face.
Moon face. Why you are telling moon?
It's round and ears not seen.
Which is not seen?
The ears.
Ear.
The ear.
Oh, fantastic. Fantastic. I think all of you understood the Dr. Abdullah's explanation. The ears
No.
usually visible in general, whatever the bulky man. But in the moon face, the typical description indicates you cannot see the ears clearly if patient looks to you straightforward. This is the moon face. Then you are suspecting what?
Cushing.
Then what do you like to see? See means you will look by the eyes, not asking anything, not measuring anything. What you will see?
Stria in abdomen.
Stria, yes, stria.
So now you are almost confident, right?
Yes.
Confident. And this is stripe, purple stripe, not the white. Okay. What is this from the birth?
Port wine.
Dr. One.
We discussed more, doctor, right? Port wine stain.
Yes.
What you are looking now? Again, my yellow color chamber. What you are looking, doctor, in the face? I told you I am looking, showing you the face. Tell the diagnosis.
Right.
Right? Sorry, Dr. Hind, can you make it clear? Right?
Right eye ptosis.
Why you need to say eye, doctor? Ptosis is ptosis. This is the eye. The right ptosis, but still you couldn't complete. Dr. Abdullah, why are you not completing? Right partial ptosis.
Facial palsy.
Is that a facial
yes.
palsy, doctor? No. Right partial ptosis only. No facial palsy. What you are looking here?
Kaiser flusher.
Kaiser flusher is much visible in this way, doctor. Patient have hypertension, patient have diabetes. What is this?
Jaundice.
Jaundice?
This is senile. Senile. No, is it?
Arcus. Arcus. Corneal arcus. Suggestive of what? Possibly underlying? See bilateral there. You see in the left eye also. Underlying hyperlipidemia. When I tried to pull this lady's eyelid down to see the anemia, then I can't. What is this? And I look at the mouth of the patient, I find that her mouth is as like, it is not also normal. I requested her to open the mouth. She cannot open the mouth well.
Scleroderma?
Scleroderma.
Fantastic. The skin also you see smooth, tight, shiny. What other feature in the scleroderma? What is the name of the sign?
Crest.
No. Crest is the name of the syndrome.
Right.
But finding here, sclerodactyly. If you don't know, write down, doctor, in your book. Sclerodactyly. Now here, you understand this is SLE because the name of the rash is
Molar
butterfly. Butterfly.
Butterfly.
But interestingly, you see this line is clear. There is no rash. Why this is like that? Here.
Nasolabial folder free.
Yes. Why free?
Fair.
It is under the skin and not more exposed to the sunlight. So this is sparing of the nasolabial fold is very suggestive of SLE. Because these are sun sensitive. So I hope we finish some picture interesting in the face. Now come to the eye. What is this?
Sty.
Sty.
Eye?
Hmm.
Okay, this is the same thing, hordeolum externum. This is sty. And the treatment option, topical chloramphenicol of this disease. What is the name of the disease?
Tricol. Trachoma. Chloramphenicol. Sorry.
Conjunctivitis.
Conjunctivitis, maybe bacterial. This is a scleritis. You see, usually unilateral. It is sclera conjunctiva is okay. If you pull down the eyelid, you will see this is normal. Scleritis is accompaniment of which disease?
Autoimmune.
Extra-articular manifestation of which disease?
Intestinal bowel. IBS.
No.
IBD.
No,
Sorry.
number one will be rheumatoid arthritis. I am asking about the. This is an extra-articular manifestation. But what is the primary disease? Is it rheumatoid arthritis? Scleritis. This is the sebaceous cyst.
Sebaceous cyst.
This is in the eyelid. It is removable.
How I can differentiate from chalazion?
This one?
Yes.
This is chalazion, the lead disease, doctor.
Yes.
In the margin around, inside, separate thing. If you feel it, like a cyst fluctuation will be there. Dacryocystitis. What is this now? You are looking.
Entropion. This is entropion.
Intro or okay.
Entropion.
Intro. What is the risk of entropion?
Keratitis and
Entropion actually irritating the cornea also. Eyelash irritated. So entropion, healthy eye, ectropion. This is the differentiating three pictures. So this one entropion. Entropion means like this. Hair follicles irritating or rubbing the sclera as well, the cornea. This is the and this is left-sided ectropion.
Ectropion.
Exposed outside.
Yes.
And this one?
entropion.
All are ectropion, entropion. It is also, you see, eyelid is actually rubbing.
Yes.
Eyelid is okay, eyelash is different. Now what is diagnosis? Trichiasis. Trichiasis. Horner syndrome. Which side? Right side or left side?
Left side.
What are the features of Horner syndrome in the eyes? Quickly, Dr. Hind.
Horner ptosis.
Again, ptosis, Doctor.
Ptosis.
Partial ptosis. Utter the word partial ptosis because this is the neurologic ptosis and affecting the sympathetic nervous system only. Repeat, doctor.
Ptosis, meiosis,
Oh
and
my
hydrosis.
God, doctor. Why not partial ptosis? You are telling. Please tell. Partial ptosis.
Partial ptosis, yes.
Okay.
Meiosis and
Okay.
hydrosis.
And hydrosis. Is there any other feature? Meiosis and hydrosis.
And hydrosis.
And hydrosis. So this is a question. Dr. Sama, please read the question, including the options also.
Please look at image, which one of the following statements regarding this condition is true? They represent ocular tuberous xanthoma. They are most commonly associated with hypertriglyceridemia. Complications include malignant changes in 0.2 to 0.5% of patients over 20 years. All patients should be offered statin. Treatment options include laser therapy. I think E.
E. What is the diagnosis underlying?
Xanthelasma.
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 So management could be surgical excision, topical trichloroacetic acid, laser therapy, electrodesiccation. Anyone can be utilized for the treatment of, and it is found significantly that I'm telling significant in a sense we have tested lipid profile normal, but patient has xanthelasma. These are the different skin appearance of hyperlipidemia. You see, hyperlipidemia, if palm or xanthoma, this is the picture. In the palm, there is deposition of the fat here, xanthoma. Eruptive is itchy papule. This is tendon xanthoma, hypercholesterolemia, the remnant hyperlipidemia. Xanthelasma are also seen without lipid abnormality. Remember, without lipid problem also, xanthelasma can happen. Still we have some time, we can proceed. Oral cavity. Look at, what is your impression?
Geographical
Ye-
tongue.
Leukoplakia.
Leukoplakia. But here, in this area, this is eroded, is smooth. So leukoplakia will be your whole tongue.
Geographical tongue.
More likely geographical tongue.
Geographical.
And this one, it is called black
Black
hairy tongue. Black hairy tongue. In the tongue, elderly lady, what is the age of the lady more likely? 20 years or 60 years? What do you think?
Leukoplakia.
Mouth ulcer.
I am asking age of the patient. It is a 20-year or 60-year lady seems to be.
60.
60 years. So in this lady, this ulcer is non-healing. What is your possible diagnosis?
Carcinoma.
Tongue carcinoma.
Yes.
Malignancy could be there. What is this? It is also long-lasting tongue lesion. Many medicine utilized, no benefit. Having just little burning during food, especially spicy food. What is the diagnosis, doctora? Geographic tongue again, or like
Geographic tongue.
this is acute tonsillitis. You can see here, big
Yes.
tonsil. This is your patient now. Dr. Abdullah, please go through.
Yes. 5-year-old child present with ear pain. This has been.
Sorry, Dr. Abdullah. Sorry, your audio is interrupted. So may I request Dr. Sama?
5-year-old child present with ear pain. This has been present for 24 hours, but she has also complained of mouth discomfort over
Noising
several.
sound.
All are noising. Sorry, I don't know where is the problem here. Could be some problem in the sky. There is some reason here. Let me. I am reading, doctor. Still, if you have, you will let me know. And a 5-year-old child. It should be A, not N. Okay, I am reading. A 5-year-old child present with ear pain. This has been present for 24 hours. But she has also complained of mouth discomfort over several weeks. The parents are both unemployed and living on income support. On examination, she is a pyrexia on third centile for height and weight. She has black discoloration of 6 of her teeth. You are looking at the teeth with cavities on the occlusive surface of the incisors and inferior molars bilaterally. What about the description? You are looking the picture. Ear examination is normal. Patient presented with the ear pain, but you examine the ear, it is normal. What is the most likely diagnosis? Please carry on.
Dental caries.
Why patient having the pain in the ear?
Referred back.
Yes,
Referred
refer back.
pain. Very good. Very good. Referred pain. So dental caries. Dental. What you will do as a GP?
Refer for.
Refer to dentist.
Will do nothing. Will do nothing. The social economic group, social economic group issue. Now, so we're switching to next topic. Little topic, doctor. Skin issues. A lot of pictures in the skin, and someone is pleased to remind me later also. There are 2 links. Did I give you before? Possibly I have given 2 links for
No.
the skin in the
No, I
lecture
didn't.
class given. Possibly you missed. We will provide again. Dr. Sama.
What is the diagnosis in this 78-year-old man?
Here, age is important to diagnose the case, and the picture important also to diagnose the case. What is the underlying? What is the diagnosis? What is the diagnosis?
Is
This is the blistering
no
disease.
no involvement of mucous
Mucous
membrane.
membrane not involved.
Pemphigoid.
Pemphigoid. Okay, why not pemphigus?
Pemphigus vulgaris involve mucous membrane.
Okay, and then here
and,
if you look at the lesion in
yes,
the pemphigus,
Not
possibly you will not get the intact blister
yes.
because pemphigus is very thin. Elderly gentleman, he was having chest pain before. He was a smoker, hypertensive, dyslipidemic, and diabetic. What you're looking there in the chest?
Gynecomastia. Yes.
Gynecomastia. Actually, he was operated. Are you seeing any scar mark?
No.
No. Yes, this is the scar mark.
Temporary.
Sternotomy, doctor, remember the word sternotomy. There might be gynecomastia if patient is on spironolactone and other. But this is
Yes.
sternotomy done. I told you chest pain, diabetes, hypertension, and other. What operation done?
Open heart failure.
Which one, doctor? Operation.
The open heart failure.
Open heart surgery. Open heart surgery for what? What they have done? Bypass surgery or valvular surgery?
bypass.
More likely bypass surgery because I tell you diabetes, hypertension, dyslipidemia. What you're looking, patient develop pain, burning, and also irritation in this area in single day. Okay.
What is the area?
In the flank, doctor, flank of
Shingles, herpes zoster.
elderly lady. And the second day or third day, possibly she developed like this.
Herpes
Same area.
zoster.
Herpes zoster, right? Herpes zoster. Thank you. Patient does not have any other problem, but his skin is like this, black in this area. You can see in the neck also.
Nigricans.
Acanthosis.
Acanthosis
Nigricans.
nigricans.
Yes.
This one,
Herpes zoster.
Herpes zoster.
very good, very right. This is actinic keratosis.
Yes.
The scalp, actinic keratosis. Causes of lesion here is OCP. What is the name of the lesion?
Spider nevi.
This is a seborrheic keratosis.
Seborrheic.
Black area, seborrheic keratosis. Elderly patient.
Yes.
Now a patient, Dr. Hind.
Child present with rash or with this rash. What is the most appropriate management strategy?
Okay. Look silently and give your answer.
A.
A. Other option from other colleague.
A.
Molluscum contagiosum.
Advise that no specific treatment is needed. So is molluscum contagiosum.
That's
Why
right.
not? This is chickenpox.
Complicated. There is in chickenpox. Usually, we'll see different, vesicles. I mean, yes, we will see different stages of the chickenpox rash, but this one only umbilicated.
Okay, different stages of chickenpox. In addition, red area surrounding the lesion is more in the chickenpox. Dr. Abdullah, please can you read again? Dr. Abdullah.
Yes. 60-year-old male presents with a sudden onset eruption blisters. He gives a history of pain in the affected area a day prior to the eruption of the blisters, for which he applied a topical analgesic. What is the most likely diagnosis?
Remember the pain one day before appearance of the skin rash.
C. Herpes zoster.
Already we discussed. See, eh? Remember the pain first, then skin lesion. It is herpes zoster. Okay, skin. Just few picture to you. Maybe don't worry, we can finish in time. In the hand now. What you are looking?
Clubbing.
Only clubbing?
Cyanosis.
Leuco.
Young patient. Cyanosis is there. What may be underlying disease? Cardiac disease.
Cyanotic heart disease.
COPD.
What?
Cyanotic heart disease.
Name one of the cyanotic heart disease.
Infective endocarditis.
Is a congenital disease, Dr. Abdullah.
Fallot. Teratology of Fallot.
Tetralogy of Fallot.
Okay.
What you're looking in the hand, in between the finger waves? This is itchy.
Fungal infection.
Fungal infection. Which fungus? Which fungus? Is working in a hotel, serving the people with the water and other, cleaning the table. Candida.
Swan neck.
Swan neck deformity.
Rheumatoid arthritis.
This is very school-going girl. Overnight, she developed this thing, and the next morning, mother become worried. Attended to me. What happened? Otherwise, she is okay. But she was looking to me vacantly. What may be underlying problem? There is some mark in the leg also, you see.
Suicide attempt.
No choices.
No choice, doctor. Straight diagnosis.
Just the name. It is here in my tongue, but I cannot.
Dr. Abdullah, what you are telling?
Suicidal attempt.
Suicidal,
No,
doctor. Everybody will suicide by cutting hair only.
In derma, it is the dermatological diagnosis.
Dermatitis artifacta.
Yes,
This is
artifact.
the underlying problem. It is intentional by self-cutting. Okay. Parallel cutting is dermatitis artifacta, as well as they are in the accessible part of the body, not in the back.
Yeah.
Okay. Hand systemic sclerosis, already we discussed. Okay. Hand systemic. There is a damage. There might be fingertip ischemia or gangrene also due to the Raynaud's phenomena. Bowen's disease, just to look at only, doctor. Bowen's disease. Ganglion. We discussed before ganglion. Exoid cyst. Psoriatic arthropathy. There are some nail features. Can anyone say the nail features of psoriasis?
Leuco, but
What?
Nail pitting,
Subungual hyperkeratosis, nail pitting, and onycholysis.
onycholysis, yes, onycholysis.
Still break, not ended, doctor. More pictures. In the leg. What you are looking in the leg? These are painful. Legs are painful.
Erythema,
Nodosum.
24,
Erythema nodosum. Erythema.
nodosum.
What will be the next investigation if it is erythema nodosum? Chest X-ray. Next will be the chest X-ray. You will get the finding of tuberculosis, finding of sarcoidosis in the chest X-ray. This is a young girl presented with the joint pain, and the leg is appeared as such.
Phenylscoline,
Sorry,
Henochscoline,
Hanoch-Schondlein purpura. Right, Hanoch-Schondlein purpura in the lower leg usually. What is this? This is also happen overnight.
gout pain, acute pain.
Podagra. This is the podagra.
Podagra.
Podagra gout. What is this in the skin of this gentleman?
psoriasis,
Psoriasis. Disagree. Sorry, doctor. Who can say? Ichthyosis. Ichthyosis. And what is this? This patient applying the heat over buttock by the bottle.
Abgin.
Erythema abigni. Erythema abigni.
maybe acne, yes.
This is the pyoderma gangrenosum. And a characteristic feature of which disease? Ulcerative colitis. Pyoderma gangrenosum. More pictures shown to you. This is vasculitis. Black areas like this. Vasculitis. Now a patient, Dr. Hind. Dr. Hind.
Young women present to clinic with a 3-week history of intermittent joint pain and raised rash over lower leg picture. She complained of pain on palpation of the rash on the lower leg. What is the investigation would be performed next?
What you are thinking by
Yes,
looking at the leg?
Erythema nodosum,
Erythema nodosum. What will be the next investigation?
chest X-ray,
Discussed already, to see the pictures of this. The causes of erythema nodosum: streptococcal, drugs, inflammatory bowel disease, Behçet's also. Dr. Sama.
A 61-year-old patient with diabetes shows you this skin eruption, which has developed over the course of 4 weeks on the dorsum of his foot. What treatment would you offer him?
What is the diagnosis?
Diabetic. I don't know really.
You don't know? Try your best. Anyone? This appearance. Thinking nothing. Answer, doctor. Option?
Observation.
Observation. That means you know the diagnosis.
I don't know.
Diabetic patient. What is the name of this? Sorry, doctor. What is the name of these? Granuloma annulare.
Annulare.
Granuloma annulare. So it is self-limiting. And some other picture, doctor. What is this? Quickly, we will finish.
alopecia areata.
And this lady, her age was at that time 100. Why the box is utilized?
Why they maybe HRT? I don't know.
No, HRT, no. 100 years lady, doctor. Why you are thinking HRT? Sunday, Monday,
Yeah.
Tuesday is there. 7 days medication is put in a box to overcome her memory problem, if any. What is the name of the box? What is the name of the box? Maybe Alzheimer. So that she will understand this is my today's medicine, Sunday, Monday, Tuesday. By looking the letter, not keeping in the memory. This is called the Rossetti box. Sorry, Dosetti box, Dosetti. And that's all for today, doctor. I hope the picture class was very, what I say, very good in my thinking. I don't know what is your understanding today. And we took extraordinary class today for you. I hope it will be useful and beneficial for your AKT exam. So we can conclude now here, doctor. Thank you, and waiting for the next class. Thank you very much.
Thank you. Thank you, doctor.
Thank you.